Bismillahirrahmanirrahim. Assalamu alaikum 10th class. Today's topic is functioning of kidney, osmoregulatory function of kidney and disorder of kidney. Functioning of kidney. The main function of kidney is urine formation which take place in 3 steps. Basically every organ in our body perform its specific function like heart pump the blood throughout the body, brain control all activity of blood, same in the case with kidney. It basically filters the blood and maintain its composition. By filtering the blood, kidney form urine and it takes place in 3 steps. The first step is pressure filtration, second step is selective reabsorption and third step is tubular secretion. The first step of pressure filtration, when blood enters the kidney via the renal artery, it goes to many arterioles and then to the glomerulus. When blood enters through the renal artery, these renal artery divided to form arterioles and there are many arterioles and these arterioles divide to form capillaries which is known as glomerulus capillaries because they are found in kidney. The pressure of blood is very high and so most of the water, salt, glucose and urea of blood is forced out of glomerulus capillaries. This material passes into the Bowman's capsule and is now called as glomerulus filtrate. So pressure filtration occurs due to high blood pressure in kidney. And all these substances are forced out of glomerulus capillaries into the Bowman's capsule where it is known as glomerulus filtrate. The second step is selective reabsorption. In this step, 99% of this glomerulus filtrate is reabsorbed into the blood capillary surrounded renal tubule because renal tubule is the area which is after the Bowman's capsule. And selective reabsorption occurs through 3 processes. The first one is osmosis, second diffusion and third is active transport. Some water and most of the glucose is reabsorbed from proximal convoluted tubule. Here salt are reabsorbed by active transport and then water follows by osmosis. The descending limb of loop of Henle allow the reabsorption of water while the ascending limb of loop of Henle allow the reabsorption of salt. The distal convoluted tubule again allow the reabsorption of water into the blood. So here you can see in the diagram this area is known as Bowman's capsule and this red area is the glomerulus capillaries. After that there is proximal convoluted tubule which reabsorb the water and salt is reabsorbed by active transport and water is reabsorbed by osmosis. Then you can see this is the descending limb of loop of Henle, it absorbs the water. The other is ascending limb of loop of Henle which absorb the salt. And this distal convoluted tubule again allow the reabsorption of water into the blood. The third step is tubular secretion. Different ions, keratin, urea, etc. are secreted from blood into filtrate in renal tubule. This is done to maintain blood at a normal pH which is 7.35 to 7.45. These all ions are come into the renal tubule where it enter into the filtrate to maintain the pH of the blood. After the above mentioned step, the filtrate present in renal tubule is known as urine. It moves in collecting duct and then into the pelvis from where ureters take it to the urinary bladder and urethra expel it out. The capillaries of the glomerulus arises from the afferent arterioles and join to form the efferent arterioles. Efferent arterioles are those which are entering into the kidney and efferent arterioles are those which are leaving the kidney. Blood cells and proteins are not filtered through the glomerular capillaries because they are relatively large in size. At the final stage, urine is only 1% of the originally filtered volume. The typical volume of urine produced by an average adult is around 1.4 liter per day. Normal composition of urine: water 95%, urea 9.3 gram per liter, chloride ions 1.87 gram per liter, sodium ion 1.17 gram per liter, potassium ion 0.750 gram per liter. Other ions and compound are variable because its amount are depend on the diet. Osmoregulatory function of kidney. Basically, kidney perform osmoregulatory function. It maintain the water and salt concentration in blood and body fluid. So osmoregulation is defined as the regulation of the concentration of water and salt in blood and other body fluids. Kidneys play an important role in osmoregulation by regulating the water contents of the blood. It is an important process because if there is excessive loss of water, then it makes the body fluid concentrated, while the excessive intake of water makes the body fluid diluted. There is two situations which body is facing: excess intake of water and excess loss of water. When there is excess water in body fluid, kidneys form diluted or hypotonic urine. From this purpose, kidney filter more water from glomerular capillaries into Bowman's capsule. Similarly, less water is reabsorbed and abundant dilute urine is produced. It brings down the volume of body fluid to normal. In first case, due to excess water, dilute urine or tonic urine is produced, and there is very less reabsorption of water, so abundant dilute urine is produced and it brings the body volume to the normal. Second case, when there is a shortage of water in body fluid, kidney filter less water from glomerular capillaries and rate of reabsorption of water is increased. Less filtration and more reabsorption produce small amount of concentrated or hypertonic urine. It increases the volume of body fluid to normal. This whole process is under control of hormone, and this hormone is vasopressin. Disorders of kidney. There are many different kidney disorders, but here we will discuss about kidney stones and kidney failure. Kidney stones. When there is less water in the body, concentrated urine are formed. Due to concentrated urine, crystals of many salts like calcium oxalate, calcium, and ammonium phosphate, uric acid, etc. are formed in it. Such large crystals cannot pass in urine and form hard deposit in kidney, which is as kidney stones. Most stones start in kidney. Some may travel to ureter or urinary bladder. Basically, kidney stones start in kidney, then it can travel to ureter or urinary bladder. So first we will discuss about the causes of kidney stones. The major cause of kidney stones are age, diet containing more green vegetables, salts, vitamin C and D, recurring urinary tract infection, less intake of water, and alcohol consumption. The symptoms of kidney stones include severe pain in kidney or in lower abdomen, vomiting, frequent urination, and foul smelling in urine with blood and pus. So these are the symptoms and causes of kidney stones. Now we will discuss about the treatment. About 90% of all kidney stones can pass through the urinary system by drinking plenty of water. In surgical treatment, the affected area is opened and stones are removed. Lithotripsy is another method for the removal of kidney stones. In this method, non-electrical shock waves from outside are bombarded onto the stones in the urinary system. Waves hit the dense stones and break them. Stones become sand-like and passes through the urine by drinking plenty of water. Kidney failure. Kidney failure means a complete or partial failure of kidney to function. Diabetes mellitus and hypertension, which is known as high blood pressure, are the leading causes of kidney failure. In certain cases, sudden interruption in blood supply to kidney and drug overdose may also result in kidney failure. So in kidney failure, kidney may stop working completely or partially. So there are many reasons: diabetes mellitus, hypertension, and sudden interruption in blood supply or drug overdose. This can cause the kidney failure. The main symptom of kidney failure is high level of urea and other waste in the blood, which can result in vomiting, nausea, weight loss, frequent urination, and blood in urine. Excess fluid in body may also cause swelling of leg, feet, and face, and shortness of breath. The kidney failure is treated with dialysis and kidney transplant. Dialysis means the cleaning of blood by artificial ways. There are two methods of dialysis. First one is peritoneal dialysis. In this type of dialysis, the dialysis fluid is pumped for a time into the peritoneal cavity, which is the space around gut area of digestive system. This cavity is lined by peritoneum. Peritoneum contains blood vessels. When we place dialysis fluid in peritoneal cavity, waste material from peritoneal blood vessels diffuses into the dialysis fluid, which is then drained out after some time. This type of dialysis can be performed at home but must be done every day. Hemodialysis. In hemodialysis, patient's blood is pumped through an apparatus called dialyzer. The dialyzer contains long tube, the wall of which acts as a semi-permeable membrane. Blood flows through the tubes while the dialyzer fluid flows around the tubes. You can see in the diagram, this is the diagram of a hemodialysis. Extra water and waste move from blood into the dialyzer fluid. The clean blood is then returned back to the body. The hemodialysis treatment are typically given in dialysis center 3 times per week. Kidney transplant. As we know that the dialysis need to be repeated after every few days and it is unpleasant for patient and attendant. Another treatment for the end stage kidney failure is kidney transplantation. It is the replacement of patient's damaged kidney with a donor healthy kidney. Kidney may be donated by a descendant person or a living person. The donor may or may not be a relative of the patient. because it is not compulsory that the donor should be the relative of the patient. Before transplant, the tissue protein of donor and patient are matched. The donor's kidney is transplanted in patient's body and is connected to the patient's blood and urinary system. The average life for a donated kidney is 10 to 15 years. When a transplant fails, the patient may be given a second kidney transplant. In this situation, the patient is treated through dialysis for some intermediate time. Problem after a transplant may include transplant rejection, infection, imbalance in body salts, which can lead to bone problem and ulcers. Student, our second chapter is ended now. So there is multiple choice question. You have to solve it by yourself. And for homework, you have to draw the diagram of kidney and nephron, and you have to write the structure and function of kidney with detail. This is all about today's lecture. If you find any difficulty, you can ask me. Thank you.